Hi you guys, this is Sasha and welcome back. Today I am doing my week 31 and 32 update, and OMG, so much has happened in these 2 weeks. I'm so excited. So let's just sit back and get right into it. So first of all, baby is about the size of a large cabbage, and according to what I follow online, about 3.75 pounds. But today we had an ultrasound, so I can tell you how much baby is actually measuring approximately. The ultrasound technician said he's about 3 pounds and 10 ounces, give or take. And so he's a pretty big boy at this point. I started doing predictions, and I'm super excited about that because those of you who have followed my journey from last pregnancy to this one or know about my background, it does say stillbirth. So that means I have experienced a loss. So it was a full-term loss. And to really be excited about this pregnancy has taken me quite a long time, but I'd rather be late than never. But my prediction is he's going to be about 6, no more than 7 pounds at birth. So I'm keeping fingers crossed on that. My sister, who comments on my videos and watching, hey Sade, she predicted 6 pounds 13 ounces. So in the comments below, kind of leave what you think he's gonna weigh. And that was my last ultrasound for this pregnancy as far as I know. So this would be a good time to kind of do a weight guess and see, because my last daughter, my daughter Shalaya, she weighed 4 pounds 11 ounces. So she was small. So I don't know, only time will tell. And I don't know if he's hit his growth spurt and then it's just like growing on the decline, or is he gonna hit a growth spurt right before he's born. So it'll be interesting to see what you guys think, as well as how close I am and family is. So that's a little fun thing that I would like to do on this video. I did get some ultrasound pictures. Hopefully they'll be able to focus. He has big feet just like his sister and his mom. And hopefully you can see that. Says foot. And that's his foot right there. And then we got his profile. He kept putting his hands and feet by his face, like he was head down, and then his butt is like on the top of my belly, and then his feet and stuff. So like he likes to keep his feet by his face. You know, it's amazing how babies can, you know, kind of contort in the womb, but whatever makes him happy in there. But it does make sense why I'm, when I go into physical, the way he's positioned, why I'm having some of the symptoms that I'm having. But this is what his little profile looks like. And then we got to see a really good picture of his face, but she wasn't able to take it because he wouldn't stay still long enough. But me personally, I think he's gonna look just like my husband Curtis and his big sister, because I like the facial features and everything. I might have saw a little bit in this area, but it's like, man, I really feel like a carrier in this situation, because when she zoomed in on his face, I didn't see me at all. So I don't know. Only time will tell when he arrives, but I might be losing this DNA battle when it comes to our children, which I'm okay with. So that's what's going on physically. He's anywhere between, I'm sure he's around 17 inches at this point. I tend to carry long, and the feet kind of gave the gesture of him being long as well. And so that was one thing he does have that is similar to how I carry, in terms of how I was when I was born, as well as Shalaya. But moving on to the physical wise, I am carrying definitely in the front. I had lost 3 pounds, gained a pound, and that's pretty much where I'm at. I'm only up 19 pounds. And before I told you I had, gotten up over 20 pounds. No, I've dropped back down. And when I went to the doctor in the previous visit, I know it's because it was later in the day. And speaking of that, I had a doctor's appointment during week 31, and it was a hot mess, you guys. So I agreed because my doctor feel that I wanted to be consistent on going to the doctors on Wednesday right before I turn over on Thursdays. And so I agreed to go to a different doctor because, you know, when you're delivering and there's partners in the professional group that you're in your OB's office, your doctor may not be there to deliver. If something happens, you might, you know, deliver with a different doctor, which was the case when I had Shalaya. So I'm very much aware of the doctors that are on his side of the office. But on the other side is where the previous doctor who delivered Shalaya, who has since left, used to be. And that's where they ended up sending me to a new doctor. And I just felt off the whole entire time before I even knew where I was going. They put me in the exact same room I was with when I found out I had lost Shalaya and had to go into the doctor. You could still see the room with the stillbirth and induction pamphlets still in there because that's where they go to take patients when they find out that their baby has passed or if they have like cancer or things like that. And my anxiety went through the roof. And I know they didn't mean like any harm, but the nurse and the doctor, because they're both new to the facility, were not well versed on my history, and it just made for a very complicated doctor's visit. And so I'll get more into that in the emotional part. But physical wise, I've had a lot of anxiety since that appointment. And my blood pressure was 138/88. And my blood pressure is normally always close to perfect. And I just think that my anxiety was up. I got some notes in my phone. I have experienced a little bit of nosebleed, but not continuously. Kind of just when I'm blowing my blowing my nose, it's like dry. It'll be dry in there, and it might be like a little blood that gets on the tissue when I'm blowing, but nothing major, at least in my opinion. At that appointment, baby's heart, I can't speak, you guys. I'm sorry. I'm trying to get through all this. Baby's heartbeat. Sorry. Okay. I got to get my life together. Baby's heartbeat was 156 at that appointment. I have been experiencing some heartburn. I have been having some nausea. It was mild, but then yesterday when I posted the picture on Instagram, sorry, that's my dog. She's barking at the people in the condominium she doesn't like. But yeah, yesterday I just completely threw up, and I've been experiencing a serious loss of appetite. Like, this will be the first time this week that I have eaten more than 2 meals and had a snack. So that's pretty impressive. I just don't know what's going on. It's just like my appetite is just not there. I know baby is fine. It's not that I'm hungry or anything like that. I'll just snack on a little something and then I am completely satisfied. And the doctor said that that was normal sometimes not to have an appetite. But that was my regular OBG. So I'm going to ask him when I meet with him this coming week. Braxton Hicks I've definitely still been having, and heartburn I've been experiencing even though I drink the alkaline water. So I broke down and bought some Tums. You probably noticed in this video that I'm kind of like, and then I have to say excuse me. It's kind of like I feel like I'm about to hiccup, but I don't. And I don't know if it's like a little form of acid reflux, but it's not coming up. But it happens quite frequently where I feel like I'm about to hiccup or burp and then it doesn't. So I just ask for people to excuse me. And I am a high school teacher, so sometimes that makes it like people think I'm being funny, but I'm really not. And that's pretty much I was measuring 31 weeks at a day before 31 weeks, and I'm measuring on schedule now. Like I said, other than my belly getting bigger, everything does look pretty much the same. I'll show you my stretch marks, I believe, this video. But look at my nose, you guys. My nose, to me, is finally starting to spread. And I know it definitely will by the time that he comes, because it did that last go around and it spreads really slowly. But I definitely get the pregnancy nose. If you look at like previous videos at the beginning when I announced it to now, you will notice that my nose starts to spread, but it always goes back down. But it's funny how different things that they tell you, folklore, especially in our family, that occurs during pregnancy, you do see them come to pass the further your pregnancy goes. As far as emotional, going back to what happened at the doctor's appointment, it was very hard for me because, again, those of you who follow me on Instagram, which is quite a few of you, and I appreciate that, and those who have been following me for over a year, know that last week was the year anniversary for finding out when Shalaya passed, as well as her birthday. And so we found out September 30th, and she was born October 3rd. And I was already very anxious because when I went to the doctor, it was the 28th. So it was already 2 days before her anniversary and being back in the same facility. And it was just a lot of anxiety. So to go back in that same room, and the nurse, like, she didn't ask for like a urine sample, so I had to ask that I need to give her one. Then she told me to go in the restroom, which I needed because I just went in there and I just broke down and cried. And then I told her, you know, I really just don't feel comfortable over here. I would like to be moved if I could. And nothing happened. I didn't get moved, and I told her that I had had a stillbirth, and she apologized, but they didn't do anything. And then it was pretty much repeated when the doctor came in, and he was like, well, he didn't see it in my chart. So I'm like, what do you mean you don't see it in my chart? I know that it's in there, even though that doctor has left. And so he had to click through different files because he's learning how to work this newer medical system that's got my whole medical history in there, and he came across it. But what normally takes 5 minutes at most, he just kept asking questions about the stillbirth. And like, I was already, my eyes were red, my face was puffy from crying, I was already like shaking. And even though he apologized that it took so long, it was just the worst doctor's appointment that I could have experienced at the worst time. And again, I know that you have to have patience. And one thing that we talk about in grief counseling is when you've experienced any kind of loss or any kind of trauma in your life and you're dealing with it again, try to use that moment to educate people who have not experienced or dealt with someone like you, because you could be helping someone in the future. But that was not the time, place, nor did I have the energy to necessarily want to educate him at the time. I was ready to go, and it got so bad that I did not even make it home. I had to stop on the way home. This has happened before. And my husband had to follow me home because I was so shaken, like emotionally. It just affected me. It affected me through the anniversary, and really impacted me more than I thought that I would. But I do have a separate video that I am going to post after this. I'll probably post either tomorrow or Sunday, depending on when this is posted. But that will explain what we did and how I was feeling just with the anniversary and everything. And I know, excuse me, see, that's what I mean by like that kind of reflex, and sometimes I hiccup and sometimes I don't. But that's what's going on there emotionally. I am much better now. I took some time, relax, and just focus on the fact that God has blessed me through a whole entire year, and that's what's most important. But the whole goal of this channel from my very beginning, when I started posting about my first pregnancy with Shalaya till now is always to be open and candid with you guys. It's not a popularity thing. It's not any of that. It's as I'm going through these experiences, letting you guys know what's going on, and maybe it'll help some of you who are dealing with different things. And it might not be a child loss. It might be something else that you are dealing with that, you know, people struggle with when they're pregnant, and they struggle with when they're not pregnant. Just people struggle in general. So that's what's going on there, because I don't want this video to be too long, but I appreciate those who watch it. A great thing that did happen on Shalaya's first birthday is I looked on there and I had exactly 500 subscribers, and like that made me cry. I was like, oh my God, I was just crying all over the place, because that means a lot to me that many people are interested in my story, and it's not about popularity or anything like that. I love the fact that I feel like through what has happened to me, I have a message and something that I like to talk to people about, and people like to listen. But the last thing I do want to show before I do my belly shot is I went to the store and I got 2 pair of leggings. I got a black pair and then I got a gray pair. They were both on sale for $3.99. I got them from Ross. And that's because I tried to go to Kohl's and find some maternity pants, because I have big legs and I am plus size, and they didn't have any. So I'm about to make these 6 weeks count and just work with what I got. I got some khakis and some black pants, and I guess I'll just alternate some dresses in there and call it a day. But yeah, we on Operation Countdown, you guys, and I'm so excited, and I appreciate your support and your kind words. You guys are freaking awesome, like all across the board. There's people on my Facebook who are awesome, and on Instagram who are awesome, and definitely on here who are awesome. And yes, I am wearing a wig, you guys. I don't normally wear wigs, but I need to figure out what I'm going to do with my hair. So if there's any of you who have ever had the pregnancy hair struggle, I'm just too tired to do all that. It's either I'm going to do my hair and I'm going to look a mess, or I'm going to try to look good and not do my hair. I don't know how to do both at this point. So if you got any tips, tricks, or anything like that, leave them down below. Leave what you think Josiah is going to weigh at birth down below, and I will see you in the next video. Again, I'm going to be posting just my thoughts and feelings on what it's been like the first year if you're interested. And I am going down to single pregnancy update. Oh, and before I sign off, I have an appointment this Wednesday. It's my 32-week appointment, and it's my first NST. And I think I'm going to try, if they let me, to show you guys some clips of how they do the NST, because I really didn't know how NSTs go, and I searched and really didn't find too much. So if you're interested in that, check out next week, week 33, when I post that video. And as always, I hope you have a wonderful and blessed day, and I'll see you in the next video. Bye. Let's see, he's a little under 3 pounds, but I will find out when I get my 3rd trimester ultrasound in the next few weeks or so. So I'm looking forward to seeing his little face, seeing his features. My husband and I have been kind of like doing a guess. Is he gonna look more like me? Is he gonna look more like him, what Shalaya did? Or is he gonna be like a mixture of us both? So definitely been kind of excited about that.